Assalamualaikum dear students, welcome to your channel the Anatomy Canvas. In today's class we are going to discuss with the muscles of the back on the Anatomage table. So muscles of back are basically classified into two groups. The one group which is superficial one is containing two muscles, and these muscles are the one which is over here. This one is this trapezius muscle, and other muscle which is present over here. This is the latissimus dorsi. So these are the two muscles which are present in the superficial compartment. When we remove these muscles, we can see the muscles which are present in the deep compartment. These are the levator scapulae, the rhombidus minor and rhombidus major muscle. So now we will do all of these muscles one by one in detail. Now moving on to the superficial muscles of the back. Here you can see this is the trapezius muscle, the upper fiber, the middle fiber and the lower fiber of the trapezius, and here this is the latissimus dorsi. So now we will see how these different muscles are taking origin from the different bones. So now you can see this that this is the trapezius muscle, whole of it. It has a linear origin, taking origin from the superior nuchal line, then the external occipital protuberance, then the ligamentum nuchae, the C-cervical spine, and all the thoracic spine. So this is whole the origin of the trapezius muscle, and this trapezius muscle then inserts into the clavicle over here. Then you can see little bit we will move, it will show you over here. So its insertion into clavicle, to the acromion process, and to the spine of the scapula. So this is the insertion of the trapezius. Now moving on to the latissimus dorsi muscle. So you can see over here that latissimus dorsi taking origin from the inferior angle of the scapula. Here you can see this is the inferior angle of the scapula, and it's taking origin from the inferior angle of the scapula, the lower four ribs, the thoracic vertebrae, the external occipital, external iliac crest, and thoracolumbar fascia. So this whole is the origin of the latissimus dorsi, from the inferior angle of the scapulae, then the lower four ribs you can see over here, and all the thoracic vertebrae, then the external iliac crest, and also the thoracolumbar fascia. And this muscle then inserts into the humerus. You can see over here its insertion into the, this is the floor of the bicipital groove. So this muscle, while we move, this is taking an origin, insertion into the bicipital groove of the humerus. So here in this slide you can see this was the muscle which was lower fiber, the middle fiber, and the upper fiber of the trapezius, and the latissimus dorsi muscle. So this one is the latissimus dorsi muscle, their origin and insertion. Now moving on to the nerves which are supplying these muscles. So as I told you, this is the trapezius muscle, the upper fibers, middle fiber, and lower fiber of the trapezius muscle. So I will cut this muscle to show you the nerve which is present behind, and also you can see this one is the latissimus dorsi muscle. I will also cut this muscle. Now you can see the different nerves. So this nerve which is present over here, this nerve is the spinal accessory nerve, continues as the subtrapezial plexus over here. So this nerve basically supplies the spinal accessory nerve, which is cranial nerve 18. It is supplying the trapezius. I remove this muscle also to show you the further details of this nerve. So here you can see now, this is the spinal accessory nerve, and it is forming the subtrapezial plexus, and this subtrapezial plexus is present under the cover of the trapezius muscle and is supplying the trapezius. Now the nerve which is supplying the latissimus dorsi, I will remove these muscles to show you. So this is the, just a minute. So now you can see this nerve which is present over here, this is the thoracodorsal nerve, and this nerve supply all of the muscle which is the latissimus dorsi. So superficial muscles are supplied by the accessory spinal nerve which continues as the subtrapezial plexus over here and supplies all of the trapezius muscle. Similarly, the thoracodorsal nerve, which is a nerve from the posterior cord of the brachial plexus, it supplies the latissimus dorsi muscle. Now moving on to the actions of the muscles of the superficial muscles of the back. So this muscle is these are the upper fibers of the trapezius muscle, and these are causing the elevation of the scapula. These are lower fibers of the trapezius muscles which are causing the depression of the scapula, and the middle fibers of the trapezius muscles which are causing the retraction of the shoulder joint and the scapula. Now moving on to the deep muscles which are present in the on the back. So first I will remove the superficial muscle, the upper fiber, middle and the lower fiber of the trapezius muscle, to show the muscles which are present in the deeper compartment. So here you can see this one is the levator scapulae muscle, the rhomboides minor muscle and rhomboides major muscle. So now we will see how these muscles are taking origin from the different bones. So here you can see the levator scapulae muscle which is taking origin from the upper four cervical vertebrae, the rhomboides minor muscle T7, C7 and T1, and the rhomboides major taking origin from the T2 to T5. So these are the transverse process of the upper four cervical vertebrae, then the cervical vertebrae 7 and T1, and the rhomboides major from the T2 to T5. And how these muscles are inserted, over here you can see that the levator scapulae muscles is inserted on the medial border. Here you can see the medial border, the upper part above the crest of the scapula. There is the origin of the insertion of the levator scapulae. At the base of the spine of the scapula, here you can see the rhomboides minor is attached, and on the medial border, on its posterior aspect, on medial border, you can see the rhomboides major is attached. So above the levator scapulae is attached to the scapula, the medial border just above the base of the spine of the scapula. The rhomboides minor is attached in the base of the spine of the scapula, and rhomboides major is attached on the posterior aspect of the medial border below the spine of the scapula. So these three muscles, the levator scapulae, the rhomboides minor and the rhomboides major. Regarding their action, levator scapulae along with the trapezius, upper fibers of the trapezius causes the elevation of the scapula and the shoulder region, and rhomboides minor and major along with the middle fibers of the trapezius causes the retraction of the scapula. So the nerve which is supplying the deep muscles of the back, this is the dorsal scapular nerve. So you can see this one is the dorsal scapular nerve which is supplying all the muscles of the deep muscles of the back. So now I will add these muscles to show you. First you can see this nerve which is present, the dorsal scapular nerve which is present, and now I will show you that after adding these muscles how this nerve is traveling. First we will remove the trapezius, then I will remove the levator scapulae, the rhomboides minor and rhomboides major muscle. And while we cut these rhomboides minor and rhomboides major muscle, and also some of these muscles also, so you can see over here that this is the dorsal scapular nerve which is traveling over here, and this dorsal scapular nerve supplies the levator scapulae, the rhomboides minor and rhomboides major muscle. So now to a quick revision over here. Here you can see the superficial muscles and the deep muscle. So this is the trapezius, the upper fiber, the middle fiber, and the lower fiber of the trapezius, and then the latissimus dorsi muscle, which are present over here. These were the superficial muscle. When we remove these muscle, we can see the levator scapulae, the rhomboides minor, and the rhomboides major muscle, which are present over here. And you can also see the attachment of these muscles as well. And regarding direction, the deep muscle, the levator scapulae, along with upper fibers of the trapezius, causes elevation of the scapula. The rhomboides minor and rhomboides major muscle, along with the trapezius, the lower fiber of the trapezius, they causes middle fiber of trapezius, they causes retraction of the scapula. So this is all about the muscles of the back. Thank you very much for your attention.